The state health department is now reporting 541 cases of measles tied to the outbreak in West Texas. All but 11 of those cases are in people who are unvaccinated or their vaccination status is unknown. And the virus poses potential or serious risks for pregnant women. And joining us now to talk more about that is Dr. Jessica Cantu. She is the maternal medical director of St. David's Medical Center. Thank you so much for being with us.
Sure, thank you for having me.
You know, when you start to hear about the number of cases of this virus going up and up and up, obviously there's a lot of concern, right, among patients. What are you seeing in your day-to-day practice?
So fortunately, amongst pregnant women in Central Texas, we have not seen an outbreak like they are experiencing in West Texas. But we are seeing a significant number of adults and children who are getting vaccinated to try to prevent this ongoing spread in this community.
Which is encouraging, right? That's a good thing, because we've been hearing over and over again that vaccination really is the best way to protect yourself.
Yes, it is highly effective, prevents over 97% of cases, and it's definitely what's needed to prevent ongoing transmission.
So if you have a woman who is pregnant, who is not vaccinated, is it safe for her to get a vaccination at this point?
No, so pregnant women should not get the MMR vaccine during pregnancy. It's considered a live virus, which has a theoretical risk to the baby. The best time to get vaccinated is prior to pregnancy, and you'd want to wait about a month prior to conceiving, or immediately after delivery, even before leaving the hospital. And it's perfectly safe to get while breastfeeding.
Okay, and this is really, really important, because the other thing when we talk about a live virus, babies cannot get the MMR vaccine,
Correct.
Right? Talk to us about the best ways to protect those young children then.
Yeah, so babies under 6 months of age cannot get vaccinated, and they, along with pregnant women, are at the highest risk of developing complications from measles. And so adults that are caring for them in their immediate environment by being vaccinated kind of cocoon and protect those babies in their early months before they can receive the vaccine.
I think it's important to note, you say, no vaccinations before 6 months, but typically we don't even give babies who are 6 months or older. We wait until they're a year before they get the MMR vaccine.
That is correct. And the standard recommendation is still 12 months, but we are definitely seeing pediatricians in areas of ongoing outbreaks offering that vaccine as early as 6 months, which is often done for infants that are going to travel out of state in that out of the country in that 6 to 12 month period.
Yeah. If you have a woman who is pregnant, who is unable then to get the vaccine now, who's unvaccinated, what types of things are you encouraging those patients to do right now?
Yeah, so the first step is trying to determine if you're immune, because if you have immunity, then you're not susceptible to getting the infection or having any serious complications. So reviewing your prior vaccination records, or asking your obstetric provider to do a blood test to determine if you're immune. And that definitely helps if you are exposed and are non-immune. There is a medication called immune globulin that can be given within 6 days of an exposure to help prevent an infection from developing.
Yeah. Do people typically find out within this? I mean, how long does it take from the time you're exposed to the time that you first experience symptoms?
The blood test for immunity is fairly quick, within 1 to 2 days. And if it's not going to be in a timely fashion, it's a safe medication to receive. So we would just go ahead and administer that medication, and there's no harm in doing that if we're unsure if the patient is immune.
Dr. Cantu, if there's just one thing you really, really want people to take away from what they're hearing today about the measles virus and the outbreak that's happening, what is it?
Well, in my specialty of taking care of high-risk pregnant patients, the bottom line is that measles infection can cause very serious complications in pregnant women and their babies. And the best thing to do is get vaccinated after a pregnancy or before planning one, and encourage all of those around you that are eligible to get the vaccine.
Okay. Sage advice. Dr. Jessica Cantu from St. David's Medical Center, we thank you so much for taking time out to talk with us today. All right.